Now, this was an exciting study. So here the question is, what were the aims, the methods, and the findings from our analysis of a new inhibitor for mutant IDH1. Acute myeloid leukemia patients are mutated in approximately 6% in the IDH1 gene. And because the crystal structure was published quite early of this mutated IDH1 protein, we set out to identify inhibitors that could specifically inhibit the mutant protein. And we did an in silico screening with 500,000 compounds against the crystal structure of the mutant and the wild-type IDH1 protein, and identified 5 candidates. And because we had modified metabolite, the R2-hydroxyglutarate, we could test these compounds whether they inhibit the production of this oncometabolite, and actually identified one compound, the HMS-101, as we termed it, that could efficiently reduce this in vitro. And then we went on, did mouse studies with the leukemia of mutant IDH1 and also xenograft studies with primary patient cells. So the findings of our in vitro and in vivo evaluation of this novel inhibitor showed that the survival of IDH1 mutant mice was prolonged with this inhibitor. R2-HG, the oncometabolite, was efficiently reduced by in vivo treatment. And also we show in 2 xenograft models of mutant IDH1 that the leukemia is significantly delayed and the survival is improved in these patient cells. So now we want to see what is different to the commercially available inhibitors already or other inhibitors that are developed. And we crystallized the mutant protein together with our inhibitor and showed that actually our inhibitor binds in the active center, while most of the other or all other currently developed inhibitors bind at the dimer interface. So this is a different binding site to currently available inhibitors. Whether this is beneficial or not, we will investigate in the future, but it's a different mechanism that we want to explore, especially also in the setting where patients become resistant to the dimer inhibitors and currently developed IDH1 inhibitors.